How to reduce denials. Denials in physical therapy billing seem to be becoming more and more frequent. I think there are two main reasons for this. First, more payers are requiring more frequent prior authorization. Some are requiring authorization when they haven't previously, and some are only allowing a few visits now before further authorization is required. Second, payers are implementing rules designed to prevent them from having to pay for physical therapy. For some payers, there are multiple rule updates throughout the year. These are communicated by email but can be buried beneath mountains of verbiage that has nothing at all to do with the practice of physical therapy, so they're really hard to spot. Many of these rules can seem arbitrary and not at all based on science, nor are they in the best interest of the subscribing patients. For example, some choose not to cover patient education, even when Medicare does now pay for self-care and home management training. Or what about the famous United Health policy requiring a patient summary form? We see a lot of unnecessary denials for this not being completed by the clinic. In this video, I'm going to show you 7 proven strategies to reduce your claim denials and protect your practice's revenue. These are the exact same strategies we use with our clients to ensure maximum reimbursement. Number 1, verify patient eligibility and benefits upfront on the phone. Unfortunately, we can't just rely on payer portals or the one-stop shop services for eligibility verification. For physical therapy benefits, an alarming proportion of these are just plain incorrect. We have found that the only way to ensure that you are getting correct, defensible information on benefits is to call the plan. Obviously, this is time-consuming and costly, but the alternative of not having the correct information could be far more costly in denied visits. We provide this service for those clients of ours that struggle to get this done correctly at their front desk. For them, the errors and omissions are costly, and once we show them how much money they're losing every month by this not being done correctly at the front desk, they understand that it makes sense for a company like ours to get it right for them. By verifying eligibility and benefits upfront, you also avoid errors, delays, and losses because you will have confirmed authorization or referral requirements, and you will know copays, deductibles, and visit limits. One of the biggest causes of denials that we see is PTs treating patients beyond their annual visit maximum. Another major cause of non-payment is when the patient's policy is termed and the PT or the front desk doesn't know about it. Sometimes they have another policy that you didn't know about, but maybe that policy requires prior authorization, and then you're out of luck. 2, obtain prior authorization when required. This is crucial and probably the biggest cause of lost revenue that we see. When prior authorization isn't obtained, the losses can be massive. Make sure you submit authorizations early to avoid treatment delays. Track authorization, expiration, and visit limits. That means that the PTs and PTAs have to stay up to date with their notes. Document authorization numbers on claims. This is also a service that we provide for our clients because it can be difficult for a busy front desk to keep up with authorizations. Number 3, ensure accurate documentation and medical necessity. In the clinical record, clearly document functional deficits and medical necessity. Make sure that in your treatment plan, these items are defined and relate your interventions to the functional deficits. Use standardized outcome measures such as OSWESTRI or DASH, as well as objective clinical measures. Show progress toward the goals or show that you are changing things up in order to progress the patient. Ensure the physician's plan of care is signed and up to date, of course. Number 4, use correct coding and modifiers. Ensure CPT codes match the services performed. Apply modifiers correctly. For example, GP for Medicare, KX for exceeding therapy cap, etc. Make sure that you're using the correct timing methodology. And there are 2, the Medicare 8-minute rule and what many people call the AMA 8-minute rule. The federal payers and Medicare Advantage plans and some others follow the Medicare 8-minute rule. Submit clean claims the first time. Double check patient demographics. Name, the date of birth, the policy number. Verify the NPI codes for the provider and the facility, and make sure you submit within timely filing limits to avoid automatic denials. Number 6, monitor and appeal denials promptly. Address every denial immediately after you receive it. It is also important to let the administrative and clinical staff know so that they can make any changes necessary. For example, if you suddenly find out via a denial that you don't have authorization, you'll probably want to stop treating that patient until authorization is obtained. For this reason, all the departments need to be talking to each other: billing, front desk, administrative, and clinical. Submit appeals with supporting documentation if claims are denied. Follow payer-specific guidelines for appeal submission. Number 7, train your staff on billing and compliance. Keep billing and front desk staff updated on payer policies. Conduct periodic audits to catch errors before submission, and use technology to minimize the human errors. Remember, you may never get to zero denials because even though you do everything correctly, insurance companies can be creative in finding ways to not pay you. Oftentimes, payers deny claims in error, and there really is nothing you can do about that other than catch the error and make them pay. For example, some of the worst insurers will frequently deny claims as duplicate when they are, in fact, the original claim. I do wonder, in this day and age, if that would fall under the category of intentional errors by the insurance company. Surely they could implement systems that prevent these kind of errors, but insurance companies know that most clinics don't take the time to fight denials, and so the insurance company just saves a lot of money. Reducing claim denials requires a combination of accurate documentation, proper coding, and proactive claim management. By implementing these 7 key strategies, from verifying eligibility upfront to training your staff properly, you can significantly reduce denials and improve your practice's revenue. You may never get to zero denials, but you do want to get your denials as low as you can because many of these won't be overturned after appeal. Also, the denials often apply to an entire case, and so if you don't catch them early, you end up with many visits not paid for. In my next video, I'll show you exactly how to implement an effective denial management system that catches issues before they become costly problems. We'll cover the specific reports you need to track and how to set up processes that prevent denials before they happen.